San Diego or Basel or both?
No, I'm in Basel, right?
Oh, you're from Basel?
Yeah, the other thing I do by traveling. So.
Aha. So you are the first one speaking, no, the second one, about infections and application of nanobiotechnology.
Yeah.
Please take the floor. Thank you.
I'd like to first point out why do we need improvement in the management of infections in the everyday practice in a clinic. A doctor sees a patient, the diagnosis is not established right away. They send a specimen, and very often provisional antibiotic is given, and then they will say to the patient, you either come back or we will call you when the results are available. This is very impractical. Means quite often a wrong antibiotic is started, has to be changed. The ideal situation is to get the appropriate antibiotic as soon as possible. So it means faster diagnosis. Now, when I talk about personalized medicine, this is one of the approach that we're trying to improve our management of diseases, not just infections. And it's not simply a prescription of the best medicine suited for an individual. It has a much broader scope, as I've been developing these concepts for the past 2 decades. And I finally, this is the definition I use in my textbook, is that we have a lot of omic technologies. All the new technologies are being incorporated, even other factors of individual variation in epigenetic and other factors. The concept of personalized medicine is the best way to integrate the new discoveries in biotechnology, translate them into clinical practice. And among all the new technologies, nanobiotechnology has made the most contribution. Again, I have been connected to almost all the new technologies, and this is why my concept of personalized medicine goes that it is it's a feedback from many sources. We are not only just improving the diagnosis, because they are, let's say, nanobiotechnology improves the molecular diagnosis, apart from directly contributing and so on and so forth. So how does nanobiotechnology improve our management? These are sort of general approaches, an overview. There's no time to present you data on the original things. We will provide, and there are commercially available devices for faster diagnosis than the conventional methods, even faster than the fastest PCR. And cantilevers, nanowire biosensors, and optical biosensors can detect microorganisms directly, and so we don't have to go through PCR. And the level of detection can go down even to single organisms. And what we do is study the genetic differences. We have now nanotechnology-based sequencing devices that can help us to sort out the genetic differences among the infectious agents, as well as some of the genetic susceptibilities of the patient. The nanotechnology, we have a whole lot of biomarkers being discovered by the application of nanobiotechnology, and they are very vital for monitoring the course. It's not just once giving an antibiotic you have a diagnosis of infection. The important thing is to monitor the course of the patient. And there are many nanoparticles themselves are well-known antimicrobial agents. We have impact of nanotechnology on vaccines. That is, there are novel personalized vaccines. Many of the vaccines are in a way personalized, but this is a further refinement. And even adjuvants can be tailored based on nanoparticle technologies. And one of the important things in personalized medicine is the integration of diagnostics with therapeutics, and so many of these concepts. This is just an example of, so we can have even with a confocal microscope, quantum dots, and they can be, they are just, luminescence, and we can see the color differences and identify infected cell. And nanoparticles, there are many of them. Gold and silver nanoparticles are just typical examples. They can be developed as anti-tuberculosis agents. Fullerenes are good antiviral agents, and we can adapt nanocarriers for siRNA lipid nanoparticles or siRNA-based therapies for HIV/AIDS. And Nanoviricide, I will show you a picture afterwards. It's a direct viricidal. Most of the antiviral agents we have work indirectly by interfering with various mechanisms. But this is the one that will kill the virus directly. Of course, management of antibiotic resistance is a major problem, and this is where also personalized principles of personalized medicine come in. And there are other formulations that so this is a NanoViricide. It's polymeric micelle that you can have it can attach on to a cell by different mechanisms, but it penetrates the cell. One of the things is the nanoparticles, very small size, they are very good at penetrating cells. You just have to bring them in contact with cells, and it goes inside the cell and disrupts the cell. This is a product that's being developed by a company in the United States. I know about this because I'm a consultant to the company, so I wouldn't say too much. I don't want to advertise. Nanocarrier-mediated siRNA delivery. This is again, nanoparticles enable us targeted delivery, much more precise. This is why personalized medicine, one of the adjective used is the precision medicine. That it's not just a synonym, it's an important characteristic that we can improve. So the overall purpose of all these whole concept is to improve the medical care. As I started by saying, we are not just only going through the actual compounds, better antiviral agents, improved delivery, but overall, better management of the patient. It's not just simply one aspect. And you see how we can improve the delivery for it, or whether it's going to be for an HIV virus or for we can use it again for other pathogens as well. Now, as mentioned, vaccine formulations, and it helps us to target to the delivery, target delivery to the lymph nodes. And the increased knowledge and fundamental understanding of a nanoparticle mechanism of action will help us improve the design of some of these. And also, as I mentioned, nanoparticles can be excellent adjuvants. Sorry. So I think my time is up. I will simply say that overall, there can be many improvements in our management of infections. So I think my time is up.
Thank you so much for this very nice overview. First, audience, are there questions related to this presentation? It's about personalized medicine. It's about not only about the formulation, not about the nanomedicine, but it's particularly about the management of the patient.
Yeah, total management.
And so it needs more than the medicine only. It needs faster diagnosis, so biosensors, whatever. We need a lot of stuff to do that. Could you comment on the near future of this development? Because it's always healthcare costs, and so how do you see that?
Well, I think we expect much faster developments now in the next 5 years because there's a lot of effort going into developing these things, and a lot of funds are available. When I started out, there was no interest in that. Somewhere about 19 years ago, right here, in academia there was no interest. So I tried to get the industry interested into that. And Roche was one of the first companies, but they were stuck to the traditional diagnostics, although the concept of personalized medicine, but a lot of people wouldn't call it personalized medicine. They still don't. Now they would like to use an alternative. But the whole idea is that we are recognizing the importance and giving priority for development to some of these things, both in academic sectors now and in the industry. So there are quite a few products on the market right now for improved diagnosis. And there are a number of nanomedicines. In terms of infectious diseases, there has been that much development so far in antiviral agents, but some are in development. Antiviral and also for bacterial resistance, there's some strategies being developed. So I would expect, I am optimistic now, and I think we will have a lot to look forward to in the next 5 years.
There are situations, of course, that personalized medicine, like in the case of infections, bacterial infections, you don't know what type of bacteria is causing the infection, is a real need, and then healthcare insurance agencies will pay for everything. But there are also personalized medicine approaches which maybe make the whole treatment more costly, and the real and how do you see that?
I have worked out all aspects of this. I publish commercial reports on commercial aspects. In the long run, and this is how we convince the industry to develop that, because big companies were not going into it. They don't want to produce even more expensive products that people can't afford. So this is, now they are interested, and the health care systems, healthcare authorities, governments' interest, because in the end, it will reduce. We have a tremendous waste, even in antibiotics, misuse of antibiotics in everyday practice. And it's pretty well known how much cost goes with that, how much cost goes with resistant organisms. And so in the end, we're looking for improvement in the healthcare system that will be financially sustainable, will be attractive, so that the insurance agencies will support this, governments will also, and this is the tendency, particularly in the United States, that they are getting high-level support. So, I think it's not. This is an impression. You're right. The people think, well, why for a simple infection do you need a personalized approach? Wouldn't it sort of raise up the cost of care? No. These devices for diagnostics, they are costing no more than PCR. Some of these new tests, and they're much faster.
So we have to keep the eye on the long run and healthcare costs. Thank you so much. Once again. I think we could have an open round of questions. There's still some time. So if there are questions, the speakers are here remaining. The session theme is nanomedicine approaches and mechanisms in inflammation and infection. I think we have seen several new approaches in nanomedicine, and we have and also in inflammation and infection this morning. I think we covered this theme quite nicely. If you have some remaining questions, please ask and do so. Otherwise, I'm from Holland. I love coffee. So, but we have time. Is there any remaining questions? The speakers are here. Yeah, we can sit there, but I think the audience is so small, we can do it very informally. No? Then I'm going to get my coffee. Okay, thank you so much for being here.